Hi everyone, welcome to part 2 of our Discharging Patients series. In this video, we'll be talking about how to discharge a patient that has been marked as ready for discharge. I'm currently on my ready for discharge section of my general pane. As you can see by this highlight on the ready for discharge, and that all the patients here have my ready for discharge icon, which is the red cross. Okay? So let's talk about how to actually discharge these patients. So on SystmOne, when we discharge a patient, that means that their name and their record actually leaves the ward view. So they are now gone. If we have to readmit them, the entire process needs to be done over again on SystmOne. So that's just something to bear in mind. Ensure that we're discharging patients who are only ready to be discharged. So in terms of the process of discharging a patient, we're going to right click on the patient's name and we're going to go to discharge. Here we get a secondary drop down and we're going to go to discharge patient. When we select it, we're going to get a form. This form says discharge patient at the top here. The different parts of this form are admission details, which just covers the patient's name, date of birth, the consultant they were under, and when they were admitted. And then the area that we are going to fill out, which is the discharge details. So the responsible clinician has already been pre-filled for us. The patient's discharge date has already been pre-filled for us because that was done when the doctor marks the patient as ready for discharge. So now we're going to talk about treatment status. So when I select in this little box here, I have 3 options for treatment status. So treatment completed refers to a patient that has been discharged and we don't expect them to come back. Treatment commenced refers to a patient who we've discharged, but we plan to readmit them for future series of treatments, for example, like chemotherapy. Treatment deferred is where we could not do the treatment and so we discharge a patient. So we want to bear in mind the differences between these 3 things, but especially the difference between treatment completed and treatment commenced. Like I said before, treatment completed is when the treatment is completely done and we're discharging the patient. We don't expect to see them again. And treatment commenced is when we are starting a series of treatments that involve inpatient admission, and this might only be 1 of 6 admissions that this patient has planned, or 2 of 6, etc. Now let's discuss the discharge method. So method refers to the way in which the patient was discharged. So the main way is usually clinical advice. So the doctor says that they're ready to go, so they went. They can be discharged on self, so they decided to discharge themselves. They can be discharged by a legal proxy, or they may have passed away. In terms of our discharge destination, when you click in this little box, we can see where is the patient being discharged to. Is it their usual home? Is it their health facility? Is it the morgue? Or is it a temporary home? If we have any additional discharge notes, for example, we want to document that we counseled the patient, etc., we gave them the TTH, we can put that in this discharge notes section. And if you want, you can indicate a discharge address by clicking on this green stamp to indicate where is this patient going home to. If the treatment is complete, you can also indicate where is the patient being discharged to in our intervention section. Are they being discharged to home, to another hospital, to a health center, or did they pass away? So let's fill these out now. So for treatment status, I'm going to select treatment completed. Method, I'm going to select clinical advice. Destination, I'll say usual home. And I'll probably just write a note that says TTH given. I'm also going to indicate that they're going home and click OK. Now I'm going to get this pop-up here that talks about what we were referring to earlier. It says, discharging the patient as treatment complete will end their referral. Are you sure you want to do this? What this is saying is that once we're saying that the patient has finished here and their treatment is complete, the system is going to actually end their referral to our inpatient service. And are we sure we want to do this? If you realize that actually no, I want to keep the referral to the inpatient service because the patient is due to come back for a second admission, we can select no. If you want to go forward because the patient has finished their treatment, we don't expect them back, we can select yes. So I'm going to select yes in this case. Now we do have the option of booking an appointment for the patient right away. But what I'll advise you to do as a nurse is just select no in terms of booking the appointment and have health records book the appointment for the patient. Now the system has given us another pop-up. It's asking us if we want to clean the bed that Belinda was occupying, because in case you haven't noticed, bed 10 is now empty because you've officially discharged her. So do we want to mark the bed as dirty or can we keep it clean? So I'm going to say yes, the bed requires cleaning. And we can also talk about whether or not we want to give it a regular clean, a deep clean, or a fog clean, and if we want to close the bed. A regular clean is fine for now. And so now bed 10 is empty and it has the D on it to refer to the fact that it's dirty. So we've successfully discharged our patient on SystmOne. Now I'd love you to try it. Thanks very much for watching.